There are two types are there. One is stimulants and other one is non-stimulant, okay? I'll just explain to you, like,
Sure.
Stimulants are basically, it helps with the dopamine. In the brain, we have like a frontal lobes. That's the main one part, which helps with all these executive function and the concentration and impulsivity to control. Those are the main ones. The prefrontal lobes,
yeah,
exactly,
sure.
the cortex one. That's where it's the main one.
Sure.
So these stimulants helps them to exhibit that, the dopamine releases that one.
Yeah.
Okay, it strengthens that. So it basically strengthens the brakes a lot with a whole rush of, like say a rocket going on, with full engine. It just gives you that push for that. That's how the stimulants work. And non-stimulants are, it's a slow kind of like a coaching kind of thing, very slow and pace. It takes a little time, but it helps. It's a non-epinephrine, one of the chemical in the brain. That's what helps them. So that's how they work. They are like chemicals, but they help you. You can ask me, okay, you're saying stimulants. Stimulants means already the child is hyperactive and you're giving stimulants. Does it not make him hyperactive?
Yeah.
But what it does, the stimulants what we give for a child, it strengthens the brakes. It doesn't strengthen the hyperactivity of the nature of that brain. That's what it does. So that's how the mechanism is about. So it's very, very important to understand that, because everybody, when they see stimulant, oh, it's addictive, it's bad, we are stimulating. It's not because of bad. They don't want to medicate a child, because why do you want to medicate a child when they're 6 or 7 years old? They don't want to. But if it helps them, I will highly recommend that, because you will see wonders, like how they approach their life.
So it means like even for adults, like, it's kind of emotional controlling, right, kind of thing. Pre-control.
Yeah, exactly. Yeah, emotional regulation and then executive function.
So you're saying, like, if they use the medication, that helps them, the neural pathways.
Yes.
And then will be kind of, hardwired there,
exactly.
to thinking slowly.
Exactly. I mean, it helps them to sit and concentrate. I've seen, in my, in Buckinghamshire, where I work now, in a community pizza work, I've seen so many children. It helps them so much. I mean, on the hindsight, we got side effects as well, but that's the reason why specialists are there, to tailor the medication.
Right.
So it's not like you just given one and they won't leave you like that. So in here, how we do is, like, up until 18, the community pediatric team, they take care of every year. We do annual reviews. We check their blood pressure. There is a lot of things out there. We monitor them.
It's a safe side. At least we are in UK. So
Exactly. Yeah, it is. And then they change. You see, we change. As a person, we change as they grow. Right. Maybe the dose might need to increase, or maybe they don't need it. We don't know.
Sure.
So that's the reason why it's very important we tailor that.
Sure. Okay, question now. Just now you mentioned side effects.
Side effects.
What is common side effects?
Common side effects. Okay, fine. The main thing we see is a loss of appetite. They lose their appetite.
Okay.
Yeah. And they might get some headaches. Sometimes they become hyper. I mean, like, more. It gets worse, actually.
Right,
really worse. I've seen child.
Before actually
they're already hyper.
Yeah.
And then they become more hyper as well.
Right.
And then they increases the blood pressure as well, some of them. But as I said to you, these are there. But compared to what it gives them, what it helps them to go through in their path of education or something emotional, it's a lot. And then we tailor the medication. That's why the specialists are there. Where we tailor, we look into there, and then see how it goes. Loss of appetite. Say, for example, if a child is having usually what happens, it's a peak. See, some medication, when I said to you, stimulants, the medication is called methylphenidate. We have like an 8-hour release, 12-hour release. So usually it's about lunchtime, it gets a peak. And then the kids won't have any lunch in their school. That's what we see. So we say them, okay, give them a full good breakfast. Like, say, not just like a cereal or something.
Right.
Full on, like a dinner or lunch, how we give them. Full on breakfast, take the medication. Even if they don't have anything during the school, it should be okay. As soon as they come, they're hungry, give them a dinner. If you want, in the night, you can give them a double dinner. Right. So you're having 3 meals a day.
It's okay.
It doesn't matter how. So we can all approach this. The clinicians can approach that one, and we tailor it. So there are every paracetamol has got a side effect, so I can't say that. So you can't expect
everything is side effects, but is it minimalistically to address some bigger issues in the future?
Exactly. So, but I'll say to a lot of kids, even when I say to these side effects, we tailor. We find that right balance. We need to find a right balance. You see, we don't want to lose their personality. So every child has got their own personality. We don't want to lose that. Sometimes they become very timid. We don't want that either. So we change it. So it's working very well. The parents say they're working very well, but he's becoming he's not anymore that, that boy or girl or very active. So we'll say, no, that's not good. Because we want that personality to come in. All right? So we find the balance.